welcome everyone to another wonderful episode here at Jaws and Podiatry. So we're ready to embark on a minimally invasive surgery, the correction of a bunion deformity left foot. A young patient who has presented with a painful, right? We have the function element as well as the aesthetic element, and patient has been battling this for a very long time. How many? 30 years. So, Dr. Wagner, how do you achieve this correction through 3 tiny little keyhole incisions? One incision is right here, one is right here, one is right here, and it's a phenomenal procedure for a lot of phenomenal reasons. The first part of the procedure is we want to address the bump itself, which is what people call the bunion, right? The bump. So we basically erase the bunion, the bump, with a very, very intricate instrument. Then we make a second little procedure here through this little keyhole incision, and last but not least, we straighten the toe. The end result should look like that, and it will look like that, okay? All of these procedures are performed in our office-based surgical suite, local anesthesia. Patient is awake. Patient walks in and walks out. But how is that possible? Using a pair of ugly shoes, in this case, one shoe. It is not Prada, it is not Gucci, but it works. It works very, very well. What I'd like to do is we'll keep this one short and sweet. Let's put a hold on this, and then we'll tie the after. Okay, stand by, everyone.
A few inches later.
So we're all done. About 45 minutes later, we're all set. Again, just to kind of recap, young patient came in with a chief complaint of a painful and unsightly bunion deformity left foot. We went ahead and we performed the correction. We just finished a couple minutes ago. So without further ado, what I'm going to go ahead and do, just for the world to understand, I'm going to go ahead, because we don't use any pin screws or plates. Also, the patient had a very robust deformity. A lot of people wonder, well, what happens to the excess skin, right? The bone is there. People will see, the before, obviously, and then now the after. So, Dr. Wagner, what happens to the skin? The redundant skin will contract. It'll resorb. It'll kind of just pull itself in with time. There is already, swelling. That is completely, totally normal. But with time, that swelling will start to dissipate. The skin will continue to resorb, contract, and everything's going to come back into place. The analogy that I give people is, women that are giving birth, right? All that skin, once they give birth, all the skin just kind of goes back to where it belongs, right? Okay. So basically, I'm just going to go ahead and do this. No, I'm not pushing the bone in by any means. I'm just basically doing this. This is all empty space, as everyone can see. This is where all the bone was actually removed, okay, through that one little keyhole incision. But that's basically the final outcome. The toe's not drifting to everyone's left, okay? It was over here first, before. And like I said, one little suture here, here, and then one over here, right? Let me just write that down. Thank you, Caesar. And that's basically the end result, right? And we're going to go ahead and splint the toe right here. And it's going to look really, really nice. Obviously right now there's swelling, but it looks absolutely great. The patient was actually saying, even without doing this, right? It looks absolutely wonderful in respect to the transformation. So, Dr. Wagner, what happens now? Well, the patient, we're gonna inject now a long-acting local anesthetic. Make sure the patient is actually comfortable for the next couple of days. That will definitely help with pain management. The ugly Gucci Prada shoe, we're gonna go ahead and apply that here. The patient will go home. We'll take it easy during the next couple of days. We'll come back. Today is Friday. Saturday, Sunday, Monday, the patient will come back for the first post-operative visit. During that first post-operative visit, we'll go ahead and address the foot, make sure everything is a-okay. And then a week later, we will see the patient back here. During this time, the patient will keep the foot clean, covered, and dry. Elevation is key. Make sure that we reduce swelling, and that will also minimize the discomfort.
Yay.
Caesar, what about, I'm sorry? Thumbs up.
Yay, thumbs
Yay.
up.
Okay, great. Caesar, what else am I missing? Did we cover kind of like what, most of the questions that people ask?
Yeah.
Okay, great. So Dr. Wagner, this is important. So Dr. Wagner, if you don't use any pins, screws, or plates, I don't get it. Well, the way that we perform these corrections, it's a very, what I like to call a very pure technique. We make bone cuts a certain way, and we're actually able to splint everything. Very intricate, delicate taping and splinting techniques during the course of the next 3 or 4 weeks. Dr. Wagner, can I walk during this time? Absolutely. Dr. Wagner, can I go back to work? Depending on the type of occupation. Okay, but a lot of people just take a little bit of time off, during the next couple of weeks to make sure that, let's not forget, this is an investment after all. We want to make sure that we're able to achieve that final clinical outcome to the highest standards of the care.
Thank you.
You're very welcome. So again, just one last final, Caesar, let's give everyone a last visual there. 1, 2, 3 little sutures, 3 little incisions. Yes, we're able to actually make the correction. Make sure that we hide all the incisions to the best of our abilities. We do bear aesthetics in mind.
Looks beautiful.
Patient has fallen back in love with her foot. And Caesar is going like this. Caesar, people always ask, they're always asking, do you have a foot fetish?
No. Of course I don't.
You talk like Keanu Reeves. And a few words. Okay, everyone, we will continue to do what we do. We're going to continue to educate the world that these minimally invasive anesthetic procedures do exist. Education is at the core of what we do. Very, very important. All the people out there that don't know that these surgical techniques do exist, they actually do. As always, thank you for watching.